We're on the air.
We're on the air. Woo! Hi, Matt.
Hi, Susie. It's Suzilla.
It is Suzilla, Susie and Matt. Did I see you make a new Suzilla logo the other day?
Perhaps.
Perhaps.
It's a little early for the year of the tiger, but we're going. Okay, so today is the annual Why Is There a Special Enrollment?
Oh my gosh. Today's Thursday.
Mm-hmm.
I've had 6 different encounters with people who are not eligible, who thought that they could just get health insurance whenever the heck they want, including an insurance professional.
Yeah.
Now, to be fair, this person is not focused in any way, shape, or form in health, so I'm going to give them a bye. To a degree.
To a degree, because, to be honest, we are, this next season, which starts November 1st, will be our 10th enrollment season.
It will.
This means a full decade this has been in effect.
Now, let's be realistic. Every year, or was there one year where we actually just had the normal regular enrollment period, or has it always had an extended period? Always had at least one extension.
No, there was a couple of years that we went pretty standard.
Just at of course, the first couple of the first few years, it was November 1st.
No. Remember the first year?
The first year was like
October. Yeah, I went October.
But when it settled out, it was like November 1st to December 31st. And if you got in those last 2 weeks, you'd end up with a February 1st start date.
You're forgetting the December 23rd.
Oh, that's right, December 23rd. Maybe that's what I'm thinking of. But then they scaled it. I remember, was it the Trump administration scaled it back to the 45 days?
Yeah, they went to the 45 days unless the state said, hey, we want longer.
So the state's been throwing in some a little longer, and that's fine. We went 45 official days this year, for 2021.
No.
And
get the bonus.
A bonus month. So that was it was a Washington state specific.
Yeah, you can literally set your calendar November 1st. Healthcare enrollment starts.
That's right. That's a lock-in.
That's been a lock-in for a long time.
That is a lock-in date. It's the ending date that gets.
It gets a little bit confusing.
And remember and then of course in 2021 with COVID, we had a special enrollment for a good chunk of it.
Other date that you want to put in is if your Medicare is October 15th.
Yeah, October 15th to December 7th, which is a weird date, but it is what it is. The reason behind this December 7th is because it gives the insurance companies a chance to get everything sorted out before January 1st when your new plan's going to start. Now,
seasons are something that is been around forever.
Yes.
There's a fishing season. There's a hunting season. There's a strawberry season. There is a tax season. Always file your taxes.
Yes.
So
yeah. Say that every time.
I do say that every time, and every year I get someone that loses tax credits because they failed to file their taxes in a timely fashion. So yeah, that's one of the things we tell people. It's like, always file your taxes, always open your mail. You get something that you get that's confusing about your health coverage, let us know. We'll help you figure it out.
Yep. That's what we do. That's why
you have experts in your life.
That's right. That's why you bring your experts around you. You might not know how to change a transmission, but you know somebody who does.
And we happen to be like friends with benefits. Ta-da! Health benefits, life insurance, dental, vision benefits.
Fine.
And we have a lot of fun doing it. So
we do. We really do enjoy this.
So there's a reason why there is a season.
Yes, there's a reason for the season.
There's a reason for the season.
Right. And now people are going to say, how come you can never... Okay, then how come you just only can get it whenever... This has always been the case. Even prior to the ACA, with private plans or with group plans, it's always been there. It's just you never noticed it.
Yeah, well, the group group plans, there's always been a season. It's like you couldn't roll in your boss and say, on a Tuesday, say, hey, I feel like you should give me health insurance.
That always took a lot more effort.
And it takes a lot more. It takes a heck of a lot of effort for employers to get coverage.
It's paperwork. It's surveys.
It's spreadsheets.
It's spreadsheets. It's a pain in the tushy, but it made a huge difference for a lot of people, and that's why HR people get paid the median bucks, because they're the ones making those spreadsheets.
Yeah, it's that spreadsheet manipulation. We actually prefer to go another route because we deal with the small groups, and we just say, hey, let's do the individual. Give them a stipend, call it good for the day.
That is a whole other topic. Or you can check out the video Matt just made about a half an hour ago. I think you're going to put it on YouTube?
Yeah, I put it on Facebook. It's on TikTok, and it's chaotic and wonderful. It's less than 3 minutes.
Yeah, it's fun. Matt likes TikTok.
Yeah.
He does.
So
how can you not?
So yeah, there's always been a season for it.
Yes.
Just because you hated a particular law, the ACA, that's been around for over a decade.
Now, there hasn't necessarily been the ACA. Yes, we are going into the 10th enrollment for 10th season for enrolling, but the ACA has been around longer than that. That's why when you turned,
that's true.
That's why when you turned 18, you didn't get kicked off your parents' insurance. That's why that's why a lot of other things. But the main one I always remember is the 26-year-olds on their parents' insurance. That was an ACA thing.
That is an ACA thing. That is a huge ACA thing. Being able to enroll. I've encountered people that have not, were lifetime bans.
Yeah. There you go. The lifetime maximums. That's part of it. You can't do that anymore.
So yeah, there's a reason why everything's a season. And we figured about 75 days with maybe 5 days off total.
Yeah.
Because we were working 7 days a week to get everyone an opportunity to enroll in healthcare. That Saturdays, Sundays, we had a lot of enrollments on Sundays this last year.
Yes.
We have a little scheduler so someone can, zip in, zip out as quickly as possible. And we made it as easy as possible. It was no, running down, you got to do this. It's like there's only so much running down we can do.
Exactly.
So we got a lot of people healthcare, and it's been nice. We got a couple people jumping on for live. So yeah, there is a season for healthcare.
Yes, there is.
And no Pete here.
Who's Pete?
I don't know. Just see, hey Pete. It's like repeat.
Pete, repeat. We're sitting on the fence.
Yeah.
Pete fell off.
So here it is on how to get health insurance when
you are off the season.
When you're off the season.
Yes.
And the first one is there are two things that are outside that you can get a roll in any year. The first one is you have a low enough income, you qualify for Medicaid, or in our case, our state, Apple Health.
Correct. That's what they call it, Apple Health. And like, for example, in Georgia, it's Magnolia Health. In California, it's
does it cover KA? Does it cover CA?
California's Medi-Cal.
Medi-Cal? Okay.
Yeah, that kind of stuff.
Yeah.
But yeah, they have different names, but it's all basically the same. It's basically the same program, but they have different. It's all a little bit different because it's a state-based program. But that's the concept is the same. It's to help people who are low income have health insurance.
And it's been a nice program. In our state, the CHIP program has a tag on for the kids. So that the middle class, the working folks can get help, their buy-in for their kid. Usually it's $10, $20 a month, and they get this really comprehensive healthcare plan.
Exactly. It's great if you are coming off your parents' coverage, and you're working part-time at
Mhm.
Pizza Hut, you're not making $75,000 a year. You're making $18,000 a year and living with three of your best buddies in a basement apartment.
Mhm.
Guess what? You're eligible for Apple Health in Washington.
Yeah, so that makes things easy. And then the next one that is a lot higher income based is the Native American Health.
Yes.
If you have a tribal affiliation,
you got to have the paperwork though.
You got to have the paperwork. It's not, my great aunt Frances said that I was they were a Cherokee princess. It's you got to have the paperwork affiliating to a particular tribe.
Right, you've got to have the card.
Mm-hmm. Card. I've uploaded documents.
Yeah, I've mostly these days, at least with our Washington State tribes, we have cards. Yeah.
Yeah, I'm kind of weird. I've gotten the ones from all over the place.
Oh yeah, I got a Shoshone once.
I've got a couple different Cherokee nations.
Yeah.
It was like 5 or 6.
Cherokee nations is very large, very large.
I want to say I got some from the Pueblo at one point.
Did we get Choctaw ones?
I think so.
That's a whole other conversation.
There's like 150 different tribes out there.
Yeah, just get if you qualify, if you have if you are qualified to get if you can prove the
tribal affiliation.
Thank you. Then it's worth looking into.
Yeah, it is. It took me 3 years of hunting before I found someone.
It's true.
And it was someone that had a group plan, and we were able to shop them. Mm-hmm. And I did hey, look at all these $0 copays, and they're like, what does that mean? It means you can roll into the health provider, whip out your card, and you're not paying anything for services. So
you buy the crappiest, cheapest plan you can get your hot little hands on, and you have no out-of-pocket expenses.
Yeah.
And you have a premium, but you don't have out-of-pocket expenses.
And it was really effective in our area because we're like miles away from any of the tribal centers.
Yeah, and that's where it's really nice because, ideally, if you've lived on a reservation or in your near reservation, you've got the tribal clinics and things like that, which is always a no cost for a tribe member. Mm-hmm. If you are in a situation where you can't get there.
Or if you go to school.
If you have an acute situation and you are in, East Wenatchee, then you can go to the clinic and you can, you have coverage.
So yeah, that's one of the cooler things of the ACA that we've been able to help out people. So those are the two things that are constant. Let's get into the special enrollments.
Yes, there's all kinds of reasons for that, but not nearly enough.
There's not nearly enough.
That's a personal opinion.
The first one right off the bat, we're going to throw down is, hey, you're pregnant.
Yeah.
Congratulations, you do not qualify for a special enrollment. You cannot purchase health care.
Nope, that is not a special enrollment reason. Having an illness or having a condition like pregnancy does not qualify as a special enrollment reason. Mm-hmm. Having the baby does, because you're adding a person to your household.
Correct.
But or adopting a child or
I usually use the adoption because that's everyone. Mm-hmm. It's really simple. It's like, hey, look, new kid in the household. Congratulations. It opens a special enrollment that you're able to get health insurance.
Exactly, and that's a good thing.
Now, one of the things that they didn't fix, that was monkeyed with during the Trump administration was marriage. Before it was getting married, congratulations, you both are eligible to qualify for health.
They messed with that.
They monkeyed with it so that one of the people have to have health care and provide proof of coverage. Yeah. And then when you get married, the second person could be added.
Right. That was BS.
It is, but it's one of those solid. Okay, if you get married, if one of you has health care and you get married, congratulations, you could bring the other one in and get coverage.
Yeah, and honestly, that's how group marriages have worked. Group marriages.
Wow, you're progressive.
I know, a little bit around the edges. Group insurances have worked. Mm-hmm. You work for Boeing, and your wife doesn't work for Boeing. Mm-hmm. You've had the Boeing insurance. You marry your wife; she gets to have Boeing insurance as a special enrollment.
Yay!
It's the same concept.
Same concept.
Yeah.
It's like weird on how they borrow from each other.
I know, right?
Let's see. We got that. The tragedy: your employer no longer offers coverage.
Yeah, for one reason or another.
For one reason or another, they decide it's too expensive. They let you go. You become part-time. Well, congratulations, you now qualify for you've got 60 days.
60 days.
I cannot stress that enough. If you're bummed out and sitting on the couch eating Cheetos for more than 60 days, you're out of luck.
Yeah. Another thing that is the 60-day or you're out of luck is the moving.
Correct.
And we've run into that a lot.
Well, we knew that was going to be those two things were a massive issue because of the Great Resignation.
Yeah, that's exactly true. People moved, you know. Divorce is also another reason since we're still in family setups.
Divorce, yeah, that is one of those, and you're limited.
But you have to lose the health insurance because of it.
Mm-hmm.
You know, you can't just, of course, and you get a special enrollment period if you're dead.
Yeah.
If the person who, death, divorce, things like that create special enrollment.
They create special enrollments.
Right. Okay, so moving, changes in residence is another big one. If you move to, if you live in Kansas and you've had an insurance plan and you move to Washington, well, of course, you are now needing to get a new plan because you've had a plan. You moved, you have 60 days to get your new plan.
Because you have had a plan.
You have to have had a plan in place.
You have to prove prior coverage.
Right. And that also is true if you move from a county within the state that has different coverages than counties to where you move from. If you move from King County to Chelan County or vice versa, if you've had coverage at that other county, then you can change your plan to one that suits your current zip code more effectively.
Now, one of the things that we got to stipulate there is King County is a great example.
Like 60 odd plans available.
Yeah, they've got a ridiculous amount. But say you had a Ambetter plan in King County and you moved to Chelan County, you still have an Ambetter plan.
That's true.
Because it carries both. But if you in Seattle, you had a Regents plan and moved to Chelan County,
you were out of network.
You are now out of network, and it's time to get a new plan.
Now, if you move from King County to Chelan County and you bring your Ambetter plan with you, you update your address, you could change a premium.
You can drop down, you cannot increase.
The same plan might have a different premium.
It will have a different premium.
That's right.
Because and the sad fact is Chelan County is Zone 7.
We're more expensive.
We're usually more expensive. We're either the most expensive, or the second most expensive in the state.
Okay. Other reasons why you might changes of residence is moving from a foreign country or United States territory. If you are living in Guam and you move back into the continental United States, that's a special enrollment.
These are all things that you're going to need documents for.
Yeah,
you can't say, I'm going to crash out on someone's couch. That person better be writing a rental agreement.
Absolutely. It's very, very critical to know that during a special enrollment period, you're going to want to be able to back up your reasons.
Correct. The documents are huge, and certain insurance companies are tougher.
They are. Some are easier than others. Some are extremely difficult.
Yeah, we had a address change last year for a company, not mentioning anyway names, that wanted it prior.
Before binding, yes.
And they were moving into another state, and they said, "Oh, well, we need a proof of cover. We need a proof of cancellation and coverage before we'll even enroll them in this state."
Yeah, that was a pain in the butt.
That was a pain in the tuchus. We've got customers that moved to Idaho, and Idaho's got some crazy rules.
They do.
That's our. Not all states are created equal when it comes to health insurance.
Right.
Washington State happens to be one of the best, and it's the reason why I don't work in like Florida.
Right. All right. So I'm using healthcare.gov as a resource to remind me of some of the things. and this is an interesting little note. I never really noticed this
Mhm.
before. Moving only for medical treatment or staying somewhere for a vacation does not qualify you for a special enrollment period. If you pick up and you move to, if you move to Seattle because you're having medical treatments, that doesn't qualify you.
Yeah, we've had to have the conversation more than one person. It's like, well, what if I put my sister's address in Seattle?
Then you're committing insurance fraud. Now we will not facilitate that.
It's just what, yeah, that's the conversation we have. It's like, yes, we do not promote insurance fraud.
No. Okay, loss of health insurance.
Yep, that's that loss of employer
you
coverage.
may qualify for a special enrollment period if you or anyone in your household lost qualifying health insurance in the past 60 days.
Mm-hmm.
So, or expects to lose coverage in the next 60 days. The expects to lose is great for people who are retiring or planning to quit their job, so they can have a seamless transition from the group plan to an individual plan.
Now, here is one of the keys, and this is the rule of 15. We'll start with the rule of 15.
Mm-hmm.
If you enroll in a health plan using the health plan finder from the 1st to the 15th of the month, it'll start the 1st of the following month.
Correct.
Anytime after, it will start the 1st of the next month.
Mm-hmm.
For example, right now, because it's the 27th, we're enrolling people into March.
Correct. And up until the 15th of February, in which case, and after February 15th, on February 16th, you're into April.
Yep. And that is something that people have got to wrap their heads around, because I've seen probably about a good handful of people come to us after the 15th of January with my plan's ending February 1st. Can I get a plan? It's like, okay, here's your
March 1st start date.
Here's your March 1st start date. Wrap yourself in bubble wrap. Let's go.
Mm-hmm.
The next thing we've got to talk about, and this is something that we're seeing more and more with group plans.
Mm-hmm.
You leave the job, say today,
it cuts you off cold.
They've been cutting people off cold. We've seen this for years. We're starting to talk about it more and more, because we would love to see some legislature step in and say, hey, employers, carry them out till the end of the month.
They paid their premium. Why aren't you carrying them?
Why aren't you carrying them? Because we know that by law, they've got to pay back unused premium.
Mm-hmm. And they go to the policyholder, who is the company.
So
it is a cash cow.
So yeah,
large company.
So yeah, if they let you go on the 2nd, yeah, odds are your coverage ended the 2nd. We want to see you in here immediately to get coverage going.
Yep.
Because
you'll still have to bubble wrap yourself for a little while, but it won't be as bad as if you come in up to the 15th.
Yeah, it's one of those ones that's getting really, really ugly, and I'm talking more and more to our legislators to see if we can do something about that to protect consumers.
Exactly. No. Let's see. Mostly, loss of health insurance. You get fired. You quit. You lose Medicaid eligibility. You've incomed out of Apple Health.
That's one of the ones. It's one of the scary letters. Mm-hmm. Hey, you no longer qualify for Apple Health. We expect to see this one a lot.
Yeah, this is bound to happen because a lot of folks got rolled over into Apple Health this last year because of the COVID crisis extensions.
Yes,
so we're going to see some shifts.
We're going to see some shifts, and so if you lose your Apple Health coverage, you've got a 60-day window.
Mm-hmm, exactly.
And here's the thing: because of the American Rescue Plan Act, you can be making up to 50% of poverty level and not pay a premium.
Yeah.
So yeah, you could still have zero out of pocket for the premium, and some of those plans, if you select the right plans, you'll have zero zero co-pays for
some of your basic stuff.
From your basic stuff.
Very solid reductions in out-of-pocket expenses. Definitely.
So yeah, it's definitely one of those things you want to talk to experts about,
and we will guide you through. Another reason, of course, we talked about that briefly, is turning 26.
Turning 26.
That's another special enrollment period. Again, 60 days.
Yep.
That's one of the ones you want to jump in the, I will be losing coverage in 60 days. That way, because your birthday's on, your birthday is June 7th. And you're going to be turning 26. They're going to drop, your parents' plan is going to drop you at the end of June. You come in on your birthday. You come in June 7th. We get you covered for July 1st. You have a seamless transition.
Yeah.
You do not have a coverage gap, which is always a good thing. Let's see, what else we got? Gaining membership in a federally recognized tribe. Becoming newly eligible for marketplace coverage because you became a U.S. citizen. That's a great one.
Change.
That's huge.
Or even change your residency if you got your permanent residency card.
Yeah, that makes a difference too. There's ways to, leaving incarceration. And starting or ending service as an AmeriCorps State and National Vista or NCCC member.
Yes, because that healthcare coverage ends.
And they're kind of rare, but it still works. But again, you must be prepared to document every single event that might give you that special enrollment.
Now, we had a couple that were undocumented this last year. The first one was we ran a lot of last year and the year before with a COVID special enrollment.
That's true. And that was specific to COVID.
That was specific to COVID, and it was specific to our state.
Yes. And they were using the exceptional circumstance override there. And that is not something you could ever count on. That is something that requires, they've used special circumstance for people whose Medicare plan got yanked out from underneath them.
Yeah, the Medishares. And the special circumstances also was extended last year for 90 days for the fires up in Okanagan.
That's correct. You do get some SEPs for FEMA-related disasters.
It's got to be a FEMA-related disaster.
It's got to have a designation.
So when we say, you need you really need some serious documentation.
If your house burns down because you let your Christmas tree dry out, that doesn't count. Because that's not a FEMA disaster. Now, if the entire city burns down and FEMA says, yeah, that's a disaster, and FEMA funds start being assigned, then you've got a shot.
You've got a shot, but it's got to be declared.
Oh, yeah, FEMA's got to do their part.
Well, yeah, the governor, it's not FEMA's got to do their part. No, it's got to be declared by the governor.
Yeah.
And I've got to stress that enough. It's a government action.
It is. It is a government
It's not just a federal action. It's a state level.
State and federal does work in concert with these rules.
No.
Not always well.
Not always well.
But they do work. They do work together.
So yeah, there are some limitations. So yeah, you can get coverage outside of the open enrollment.
But it's got to be a really, really, really special reason.
It's got to be a special reason. What we've been doing is if you do not have coverage, we say, let us know immediately and we'll run an application.
Right.
And because we'll walk down the list. If there's anything special going on, we can activate you immediately.
Exactly.
If not, you've got one that's ready to go so that when November 1st rolls around, you can select one of the new plans and be set for 2023.
Yeah, and it'll be so much faster because all we have to do is update your income, make any other edits to like addresses or phone numbers, and chapow, you're good to go.
It's
because
that much faster.
During the annual enrollment periods, you do not need a reason to enroll in health insurance. That's
the time, and that is
a sweet spot.
That is the sweet spot. You don't need additional paperwork. You get everything done. It's now we're into the special. You need what's your special permit to get in and go get that big game health care?
Gotta have an ACA tag.
Yeah. We tell people, we give people a hard nose on a regular basis.
And we don't like to, but that's the case. We have to be honest. We're not going to play fast and loose with the rules because we like our jobs and don't want to lose our licenses.
Yeah, it's one of those ones. Yeah, sometimes we have to say no. It's not our rules. It's the rules that have been set up for a decade. There are rules out there to protect consumers, to improve the system. Not everyone does, 7 days a week for weeks on end, like we do.
Yeah, no.
We don't get paid hourly wages.
No, we don't. We do not by any stretch. Otherwise, we would be making about 25 cents an hour or so.
Yeah.
Yeah, and then there's that old saying, was it ignorance of the law is no defense?
Yeah.
Just because you didn't know there was an enrollment period that you had to stick with doesn't mean you get to jump in whenever you want.
Mm-hmm. And they do that particularly to work on keeping the cost at a reasonable rate.
Yeah, I mean, we've talked about insurance pools and how insurance works and why there are enrollment periods. You can't just walk up to the slushy machine and pull down and get a cherry flavored health insurance plan.
And let's kind of highlight the importance of insurance, because we were yesterday at a Health Alliance meeting.
Yes, one of our Medicare providers,
and they mentioned what was the number they used. It was like 4% of they were doing. The expenditure.
Yes, 4% of the money paid out in claims. No, okay, of oh my gosh, I don't have the note with me, but it was of all the claims that were made in 2021. 4% of the claimants, people who had been sick, was like $26 million.
Yeah, it was a huge number.
A very, very small number of people racking up huge bills. That's COVID.
Yeah, that was COVID.
And a lot of them died.
Yeah, they released the actuary guys released the numbers for 2020.
Oh, did they?
They finally did.
Ooh, could have been pretty.
No, it 2020. Now remember, last year was bad. 2020, we were just kind of getting into COVID. 2020, the death rates spiked larger than they did during the 1918 pandemic.
I knew that much.
Yeah, but that was the first confirmation, and it wasn't just all the primary deaths; it was the secondaries, like not being able to get into rooms. The additional heart attacks that were listed as heart attacks and not COVID.
They had a heart attack, but they couldn't be seen in a timely manner, or they were, or no,
that's not what I'm
That's not what you're talking about. Okay, clear it up.
I am talking about the ones that were, they had a heart attack. We're going to list it as heart attack, and we're not going to put COVID on the death certificate.
Oh, okay. So
there was a large spike of those.
Gotcha. So it was like a heart attack that may have been facilitated by COVID.
Possible.
But it's hard to say.
Yeah, unless you get in there and do a firm diagnostic, you're not going to get it because of how the system of coroners are. They don't give autopsies for everyone, and they don't have professionals everywhere.
God knows they wouldn't have had time.
And yeah, they wouldn't have time.
I mean, they barely had time to process and get them to funeral homes.
And we also know that there have been requests from families to change death certificates so that they're not listed as COVID because of the stigma attached.
Yeah, which is weird.
It's the politics.
I get it, but it's still weird to me.
Yeah,
it's politics. And that's true. But the fact is, there are over 850,000 confirmed official COVID deaths in this country. We're coming up on 900,000 people dead, specifically confirmed as COVID.
Yeah, we've got a death rate around 2,000 a day.
It's not good. No, we're going to hit 1 million. Yeah, and people, I mean, it's not good.
So yeah, it's one get your health coverage, maintain your health coverage. If you lose it, let us know.
And
we can be on it.
We'll see what we can do
as quickly as possible.
Yep. Now, if there is a special enrollment declared this year, not betting on it, not holding my breath for it. If there is, we'll let you know.
Yeah, we haven't. We've asked a couple of different times. We haven't heard anything about it.
No, nobody's at this time.
We've heard rumors.
There's always rumors.
no, I've heard rumors that they're talking another round of COVID relief.
Oh.
But
There's
here's the politics around it. The fact that the Build Back Better Act hasn't passed.
Yeah.
And they're looking at piecing that out.
Yeah, that might be the only way to see the ACA benefits.
Yeah, because there's a huge difference in tax credits.
Massive.
And then
massive. People's rates are going to just jump like crazy if this doesn't get passed.
Well, it's gonna impact the higher
age people.
It's the higher income people.
Oh yeah, the older, the more wealthy. Mm-hmm. All the same problems we had before 2020. Mm-hmm. It's going to come right back in, and it's just going to drop the insured rates again.
Yeah,
and that's not okay.
But we've got to lead in because of the higher number enrolled that they'll have to lower rates.
Yes, we do have a larger pool now.
We have a larger pool, and additionally, that they're not spending all the premiums on actual health coverage
because people are not doing anything that's not like super critical is awaiting.
It's not super critical.
I cannot remember the word I'm looking for.
Plus, remember it as an
elective. The word is elective.
Remember as the added bonus, a number of those different bailout programs to help the hospital on pay for COVID patients.
Mm-hmm. Oh, they're starting to fade, aren't they?
Well, it's not that, but that kicks in and eliminates that care coverage.
It does help reduce some of the costs from the carriers.
So it's a by default reinsurance corridor.
Oh, that's funny. It's not permanent though.
It's not permanent, so yeah, that's the trick. So
nothing's permanent. It's too many politics.
If you don't have health insurance, please, we want to hear from you as soon as possible so that we can work on this to figure out why or if you can get health insurance.
Exactly.
There's no reason to be running around saying, I don't have health insurance. I don't fund GoFundMes.
No, he doesn't. He's
in that manner. I've got one up in Okanagan I'm looking at because they want to redo a mural.
Oh, the mural's cool.
The mural is cool.
That's different.
Yeah, I saw that on that NCW News for All.
Yeah.
That pulled that and it's like, oh, that's a cool one. Yeah. So get out there, fund some GoFundMes that are some cool projects.
Look at your Kickstarters. That's not like I've got a Kickstarter going. Yeah. I'm funding a Kickstarter right now.
I see how you are. Okay,
you knew I was going to do that.
I have no idea what she's talking about. All right, so hey, have a great day, and we will talk with you next week on Suzilla.
Bye.
Bye.